In this video, we're going to be talking about what happens if your kidneys are not functioning properly. You can go through a process called dialysis. So there are two different types of dialysis. The very first one is called hemodialysis. So basically, you're using something called a dialysis machine, and you would be hooked up, and your blood would be basically taken from your body and put into the dialysis machine from an artery. So basically, the waste from the blood would be pushed against a semi-permeable membrane in the dialysis machine. And there's fluid on the other side of this semi-permeable membrane that's always constantly replaced so that it has the proper amounts of different ions and different substances so that it basically uses a concentration gradient from your blood into this dialysis fluid so that it's a really easy process to remove any of the waste products into your dialysis fluid. So the dialysis machine is basically acting as your kidney because your kidneys aren't working properly. Eventually, once the blood is clean and all of the wastes are removed, the blood is then put back into a vein in your body. So we just have to make sure that all of the concentrations in our dialysis fluid are correct because we don't want stuff that we want to keep in our blood to actually move into our dialysis fluid. So for example, you would have like really low levels in the dialysis fluid of urea because we want urea to move into the dialysis fluid and we want to get rid of it. You would have really low levels of it. Okay, but things that we want to keep in our blood, usually that are like reabsorbed back into our blood, we would want to just keep in our blood. So basically, we would have really high levels of them in the dialysis fluid, like glucose or sodium, for example. So it wouldn't even move across that semi-permeable membrane because the semi-permeable membrane is basically just using diffusion. So the machine itself doesn't actually have the ability to do active transport and push things in or out of our blood. We're just using diffusion and using concentration gradients. So yeah, basically just concentration gradients moving across. So we have blood that would be filled with waste that would go from your arm or from wherever we're taking it from. We would connect it to the dialyzer, I think it's called, the machine, the dialysis machine, and semi-permeable membrane would be in the middle of the dialysis machine. You would have the dialysis fluid that would be filled with all of these like concentrations that are right, and eventually all of that waste that we don't want in our blood would go into the dialysis fluid and we would get rid of it, and the clean blood would then go back into our body. So that's kind of the general idea of hemodialysis. Peritoneal dialysis is a little bit different. So this time, instead of using a dialysis machine, you're actually using basically your abdominal cavity and the lining of your intestines as a semi-permeable membrane. So we pump dialysis fluid into the abdominal cavity, and then the lining of the intestines act as that semi-permeable dialysis membrane. And we again have to consistently replace the dialysis fluid, and we get rid of the waste into this drainage bag. So it's using the same kind of idea, but just different substances or different things in the process. This one is something that you would normally do at home, whereas hemodialysis might be something that you're doing at the hospital. I'm not an expert on this, so I wanted to watch this video because he explains it really well. He's actually a doctor, so I wanted to show you guys his take on dialysis.
Dialysis. Dialysis is when we replace a function of the kidney using special equipment to clean the blood. There are two basic kinds of dialysis: hemodialysis, which happens outside the body, and peritoneal dialysis, which happens inside the body. Hemodialysis is when your blood is passed through an artificial kidney, which is called, of course, a dialyzer. You'll need to make some changes to your diet and drink less fluid. Hemodialysis is usually done for 4 hours, 3 times each week, and requires access to your blood, either through an intravenous line inserted in your neck or a fistula. A fistula is created surgically by connecting an artery and a vein in your arm. Now, this can take 3 months to be ready for use, so it requires some planning. You should ask your doctor which is the right option for you. Occasionally, hemodialysis is done at home, even sometimes at night while you're asleep, which frees up your days and your diet. But most of the time, when we were talking about HD, we were talking about you going to a clinic or a hospital to have it done. Peritoneal dialysis, or PD, is when the blood is cleaned through a lining in the inside of your abdomen called your peritoneum. With PD, we put a tube close to your belly button into the peritoneum and pour in a special solution called dialysate and leave it there for a few hours. The solution slowly sucks, the medical word is diffuses, the waste products out of your blood. You then drain the fluid back out through the tube and then fill up the peritoneum again. We call this an exchange, and it generally takes 20 to 30 minutes. There are two ways to do peritoneal dialysis. This has to do with the timing of the exchanges. So first we have continuous ambulatory peritoneal dialysis, or CAPD. Typically this means 4 exchanges that you perform yourself every day using bags of dialysis fluid. During the time between exchanges you can move about as normal. Secondly, we have APD, or automated peritoneal dialysis, where a machine that you set up just before going to bed does the exchanges for you at night for 7 to 10 hours while you are asleep. During the day, you might have some fluid in your abdomen, but you are free to move about normally.
So that's basically all we need to know about dialysis. So if you have any questions for me, please feel free to ask, and hopefully you have a good day. Bye!